So we have Dr. John Batty with us. He's a cardiologist at Artesia General Hospital. But we're talking about the COVID-19 vaccine. One question we received, and there's the Pfizer vaccine and there's the Moderna vaccine. The Pfizer has to be kept much colder before use than the Moderna does, but they both have to be
transported in such
right
storage. It has to be
why do
70 degrees.
Why do these have to be kept so cold?
The mRNA vector is fragile, and it can be broken down if it gets too warm. Similarly, the preservative capsule is much more resistant at cold temperatures, and so it just this has been shown to be the way to keep the vaccine effective. Moderna still has to be kept cold, not as cold. So
right.
I think it's like minus 30.
That's a big improvement, over minus 70. What about folks that do have health issues, chronic health issues? Maybe they have heart issues, lung issues. As a cardiologist, you're probably familiar with patients that have these types of conditions. How does the vaccine affect them, or does it affect them any differently than a healthy
No, the vaccine is protective in those populations. The risk is if they get COVID and they don't have the reserve to embrace, the problems of a severe COVID case, where there's inflammation of the endothelium, heart attack, strokes, renal failure. It's just debilitating.
And are all doses exactly the same, or are the doses adjusted depending on the height, weight, age?
The doses are the same.
They're exactly the same.
Yes. Yes, sir.
So older folks that maybe can't handle just normal dosages of regular medications, they shouldn't have any issue with the vaccine?
No. We have been vaccinating all the elderly people that we can get our hands on that are in our database, and there's been a huge clamor for folks to get in. Some of them have difficulty with transport and things like that, but yes, this has been highly successful in that population, which is most vulnerable.
As soon as we started vaccinating people in the country, we heard about the variant in the UK, and then there was somebody in Albuquerque that traveled to the UK that has the variant. What have we learned about this vaccine's effectiveness against these COVID-19 variants?
It appears to be effective, particularly against the UK variant, because of the common denominator of the spike protein and the antibodies' effect neutralizing the spike protein. Now, will that be true of all of the variants that are out there? That remains to be seen. I mean, the South African variant, the South American variant from Brazil, these have questions related to them. But right now, this seems to be effective. And if not, it will attenuate the course of the disease, making it less virulent, less likely to inflict problems. So there are legitimate questions here. We don't have all the answers yet, but we're running madly to try to answer those questions.
What affects a virus that causes these variants? I may be getting into the deep science of a virus on that, but why does a virus vary, or what?
Well, the virus is an organism that wants to survive, just like antibiotics and bacteria. Once you come up with an effective antibiotic, the bacteria starts working diligently to neutralize that. And so the virus is an organism that mutates. It can change. Cold viruses are notorious for this, as are flu influenza viruses. And so, I think that there's evolution in this regard, but needless to say, this is the brightest light we've had for dealing with it.
Sure. And you mentioned the cold virus. That's a virus. Of course, the COVID-19 is a virus, but they're not the same family of virus. I mean, how can we come up with a vaccine for the COVID-19, but we seem to be unable to come up with a cure for the common cold or the flu virus?
Well, there's an order of magnitude of difference in the risk. And so how compelling the case is to get this underway is recognized as being different. And this is the question. I mean, how is it that we've had the cold virus around for eons? Corona shows up and wow, we've got a vaccine in less than a year. So how come they can't do the same thing for the cold virus? And, there's not the same degree of research support. I mean, the government, put initially $10 billion into, the research and production of this virus. Initially, they were going to make 100 million doses. Now they're going to make 600 million doses. So it's a recognition of what we need and how effective this is.
Yeah. Well, people have died from the flu, or they've died
Absolutely.
from the cold. But the like you said, the magnitude, the numbers of people that are negatively impacted that way versus this particular virus it's a big difference in all that. There have been stories that people have gotten like Bell's palsy from the vaccine. Have you seen that is verified, confirmed, or?
Okay. There are initially concerns about previous vaccines related to Guillain-Barré and Bell's palsy. These haven't been borne out, and they certainly are not applicable in this situation. In the Pfizer trial, there were 4 cases of Bell's palsy out of 45,000 individuals, which is not significantly different from what you would expect in that population. And no, Bell's palsy and Guillain-Barré are not a part of this picture.
Okay, because that's a concern that people have when they read those statistics. If you've had COVID, should you get the vaccine?
Yes, but you need to wait 3 months.
Okay.
Optimally. Okay. But yes, you need the vaccine because of the uncertainty related to how long your antibody response will last.
Okay. Is that one of the, like when you call to sign up, because the hospital and all the other vaccination centers are operating under the priority list that the state has developed. Was it phase 1?
Yeah, we're phase 1B now.
Right now.
Okay.
But is that one of the questions that is asked when you sign up to get?
There's they ask about your allergies, your medical history, what medications you're taking, have you had the vaccine, have you had any other recent vaccination? So these are all questions that they ask.
And then that determines where you fit into the priority schedule.
Right.
You've seen what the priority schedule list. I know there's a lot of talk that we need to move teachers up, or specific different people need to move up. But are you confident that they've worked really hard to come up with the best priority list possible with this?
Yes. Right now we're in phase 1B, and that includes individuals that are older than 75 or 16 or older if you have risk factors for COVID. So that's the population that sort of has been mandated currently by the governor. And so we're following those recommendations. Now, as we get more vaccine doses, our allotment increases, we can expand that, because the goal is to get 80% of the population vaccinated as quickly as possible.
So what happens when we get to 80% of the population vaccinated? Because there's that term herd immunity that is thrown about.
Well, this is the statistical idea that at that point we achieve that. Now, again, will that be effective? Will we be able to stop wearing masks and go out to the restaurants and things like this? Well, that's going to be a work in progress, and we'll have to see.
Speaking of the mask, you've had the vaccine. Do you still need to wear the mask?
I wear a mask. It's 95% effective. It's not 100% effective. And so there's still a potential for, you're not having the immune response you think. And so for the time being, hand washing, wearing a mask, using hand sanitizers, that's going to be part of our life for still a period to come.
When we were talking about this during the break, one of the positives, if you will, is because more people are spending more time washing hands and using hand sanitizer and wearing masks. Have you seen at the hospital, and have you seen across the country, a lowering of the instances of some of these other illnesses that affect people this time of year?
Absolutely. The flu season is virtually non-existent, which usually is raging, and it's been attributed to the protective measures people have taken to avoid COVID. So that's been one of the positive aspects of this.
And that's one of those things that when this all started, I thought, well, we should be washing our hands. Anyway, we should be not coughing on people anyway. I mean, that's just normal, how it should be anyway. But now, because of the increased awareness and focus on that, that we've had to do that. One of the questions I see here, a new strain in Texas. I haven't heard about that. What have they seen coming out of Texas?
Well, I think this is, Colorado and Texas acquired the variant that came out of Great Britain.
Okay.
So, how quickly will that be a problem for us? Well, that remains to be seen.
Okay. I think you touched on this earlier. How about people that are women that are pregnant or breastfeeding?
They should get the vaccine at their earliest opportunity.
Okay, so there's no negative.
There's no danger from getting the vaccine if you're pregnant. And what's more, if you generate the immunity and you're breastfeeding, you can transmit that immunity to your infant, which would be an advantage for that person.
Okay. One of the things that we're hopeful for is that kids will be able to go back to school here in the next couple of weeks, at least under the hybrid mode. Some of the data that we've seen indicates the kids either don't get the COVID or don't have the same symptoms or same impact as the older folks do. But do kids still have the potential to pass the virus on, or what have you seen in the younger population?
Kids can have a high rate of being an asymptomatic carrier and transmitting it, and they can be asymptomatic. And so there's a potential for a reservoir here that could recirculate the virus. So again, the kids are not recommended for getting the vaccine right now while it's still scarce. Now, might it be that we're going to open this up and vaccinate more folks so that we don't have this reservoir? Well, that's a possibility, but right now it doesn't appear that that's a necessity, particularly when the doses are as scarce as they are.
Now, well, that's interesting, because that's going to be kind of like a test point. The governor talks about assuming more risk. How much more risk can we start to bring into our society, if you will? And so this having the kids in school congregating together a couple of days a week, it's going to be interesting to see what the effect, if any, is on the spread rate and so forth.
Yeah, but one of the reports that I had seen from the East was schools that observed the precautions were not a source of further contagious activity and spread of the infection. In fact, it was virtually non-existent in those schools. So, so it is possible to deal with that effectively. And the distancing, hand hygiene, things like that, wearing masks was effective in those schools.
Right. Let's see. If I get sick on the second dose, do I get to use COVID PTO or my regular PTO?
That's a hospital issue.
That's a hospital issue.
And
okay.
So,
right.
yeah, that was
not necessarily for the general public.
Yeah.
Okay.
Yeah.
Yeah, and we've talked about a lot of these other deals. If you get side effects, if you do get the vaccine and you have side effects, what generally have the side effects been that people need to be aware of?
Yeah, feeling weak, not as energetic, maybe a sore shoulder, mild symptoms like a cold, upper respiratory infection. Some people have had fever, and this is a bit more common with the second dose, but it's quite transient. It goes away usually within 12 hours, maybe 24 hours. You can take Tylenol or one of the nonsteroidals, anti-inflammatory agents, but it's usually a quite mild symptom.
Okay. Now, Artesia General Hospital is where people can sign up to receive the vaccine. There's also, the state has their registration database. Do you recommend people register at both or call the hospital first? What are we recommending folks to do that want to at least get in the system and get potentially get scheduled here as soon as they're eligible?
Okay, there's a COVID hotline for the hospital, and that's 575-736-8369. And there's also a website, artesiageneral.com, where you can sign up. So those two areas give you the opportunity. You're going to be prioritized based on your age and your underlying risk. Okay, so you're going to need to provide that information. And then the state similarly has an opportunity for that, and if you go through the hotline, if there's an issue, you can be referred to that. We want to vaccinate as many people as we possibly can. Every dose that we get in is going into a patient right now. There have been none that have been wasted, and I have to say that Jeremy Kern and Kim Salgado and the Memorial Clinic have been unbelievably effective in getting this population and the community taken care of, and will continue to do so, because it's probably one of the most strategic things that we're going to encounter in our careers in medicine is getting this out there. So, as we get more vaccines doses available, we'll be disseminating those. There's talk of having a drive-through shot clinic in the not too distant future. So we are very much interested in getting this out to the community.
And that hopefully would be for both the initial one and then the follow-up one. Is it both Pfizer?
That's for sure. If you get the first one, you're going to get the second one.
Yeah. Now, if you get the Pfizer first, you get the Pfizer second. You don't get the Moderna second. I mean, you don't mix them up.
We don't have any data about mixing and matching. If you get one of one strain, you get the second of the same strain. So, we know that works, and the other is not, we don't know.
Don't mix and match, right? I got one of each. I'm good now, you know.
There you go.
That's probably not the best thing. Anything else you want to mention? Anything that we didn't cover that you want to make sure that we stress to the folks today?
No, I think those are the main issues that I wanted to make sure we shed light on.
Because we've given the number at the hospital. It's 575-736-8369. That's the COVID hotline at the hospital, and that's where you can begin the process of getting signed up and put into the queue, if you will, to find out when you're eligible.
Or the artesiageneral.com, because I'm fearful that number is going to be overwhelmed.
Okay.
So there are other.
So go to the website, artesiageneral.com, and look for the vaccination sign-up deal. Well, you've had the vaccine.
I have.
You seem fine.
You don't like my pointed ears?
Now, don't say that, because somebody's going to pull that out of this, and they're going to say, see, Dr. Batty said. But you're very confident that this is safe, this is effective, and that the best way for us to move on beyond COVID is to get as many people vaccinated.
This is our best opportunity out of this very, very difficult period.
Very good. Dr. John Batty, cardiologist with Artesia General, thank you so much for your time today. We really do appreciate it.
Glad to be here. Thanks for having me.
All right. We're going to take a break here for the Fox Business Report. We'll be back to wrap up the hour right after this.